Hello people, in the exam they will ask you skin tuberculosis, so you should know what and all to write. So what will they ask you in the exam? Skin tuberculosis they will ask you. So this is going to be, you have to just write some words here called as Lupus vulgaris. Lupus vulgaris, a mild form of TB. This is affecting the skin. So here you can see they kept a slide on this lesion and they are checking, right? This is called as diascopy. So when you do diascopy, you will see apple jelly-like nodules. Okay. So here they have written granulomatous skin diseases because of tuberculosis. When you check under diascopy, you will see apple jelly nodules. Okay. So what is this called as? This is called as lupus vulgaris or cutaneous tuberculosis. Okay. So it is called as what? Cutaneous tuberculosis. What will you see under diascopy? Under diascopy, you will see apple jelly nodules. So what are they calling this as? Lupus vulgaris. What is lupus vulgaris? It is a cutaneous form of tuberculosis. So when they are asking you skin tuberculosis in the exam or cutaneous tuberculosis in the exam, they are just asking you lupus vulgaris. In diascopy, you will see apple jelly nodules. Okay, granulomatous skin disease is a mild form of TB. What else are the skin manifestations in tuberculosis? If you want to know, here it is. So basically, extrapulmonary involvement. Obviously, this is skin is involved, not the lungs. So extrapulmonary involvement. Because of what? Because of Mycobacterium tuberculosis. This is the bacteria that is causing the problem. Right? If there is direct inoculation, then you can have this lupus vulgaris. So there is red-brown scarring. So please understand, if there is direct inoculation, then only you will have this lupus vulgaris. Okay. Then you can have some Scrofuloderma. Scrofuloderma means wherever you have changes in the lymph nodes, etc. Over the lymph node, whenever the skin has changed, that is called as Scrofuloderma. So what is Scrofuloderma? Scrofuloderma, important word. You'll hear it a lot. Scrofuloderma means the skin changes over the lymph node or the joint which has been infected with tuberculosis. Okay, that is going to be Scrofuloderma. So one more term you learned. So what and all terms you will keep writing in the exam? You will keep writing in the exam. Lupus vulgaris, lupus vulgaris, apple jelly nodules, Scrofuloderma. All these are the key words that you are writing in the exam, right? And then you can see nodular ulcerated changes. People who have very high immune response, they will have nodular and ulcerated changes. Notably, the tuberculids and erythema induratum, Bazan's disease. Okay. So they are saying that in these people who have high immune response, then you will see nodular and ulcerated changes. Okay. So what is this tuberculid? Tuberculid is nothing but the hypersensitivity reaction of the skin. Okay. Tuberculid. And then what is this Bazan's disease? Nothing but erythema induratum. See, what is erythema induratum? Hardened, right? Induration is hardening, right? So red hard, Bazan's disease. Okay. And remember the type of ulcers and all you have read in surgery, right? So if this is ulcer here, it will be undermined edges, right? Undermined edges, where will you see in the ulcer? You will see undermined edges in tuberculosis. Remember you have studied that? You see here this A. A is undermined edge. Where will you see this? This you will see in tuberculosis, correct? So this is undermined edge. You will see this kind of ulcer in tuberculosis. So basically you will have to probe because you cannot see inside, right? You have to lift this and you have to put a probe and check inside. So this is what is why in ulcer, normally if you see you can find out, but this one thing is different in probe, in palpation or thing you will have to check. You will have to put a probe and check. Okay. So why does this happen? Because the upper skin is destroyed slower than the inside skin. The inside skin is destroyed faster. That is why it has undermined edges in tuberculosis. So we have covered this cutaneous changes, skin changes in tuberculosis. So you have seen apple jelly nodules, lupus vulgaris, undermined edge, ulcer, Scrofuloderma, tuberculids, Bazan's disease, erythema induratum. Then you will see in histology granuloma, and this is in diascopy. You are seeing this apple jelly nodules. Okay. So this is all about skin tuberculosis. Hope you have learned something in this video. Bye bye.